Okay, so that was absolutely brilliant. Thank you to all of you. Normally, I would say that is a very hard act to follow, except if I did not know who my co-panelists are. Not putting any pressure on you, but if there is anybody who can try and match the energy of the previous session, it's these guys. So I have two roles to play today. First of all, I'm Iqbal Dhaliwal. I'm the Global Executive Director of JPAL. I'm based at MIT, but I look after things almost all around the world, and I have the pleasure to working with a lot of these folks. So I have two roles today. I'm also supposed to give you a closing session later, which I'll do in a bit. But before that, we are at our penultimate session of the day. And normally, by the time you've gone through 20 hours of events, you are more nauseous. And I don't know about all of you, but I'm actually feeling already nostalgic. This has been really quite a remarkable set of 2 days. Obviously, I'm biased. Okay, so this particular session is about how do researchers and policymakers end up partnering with each other. So it's a question that gets asked of me many times. You might have wondered when you saw Michael Greenstone's photo with the Chief Minister of Gujarat, that how did a professor from University of Chicago in America end up in a state in India that you may not have heard of before, a state called Gujarat, and is now shaking hands with these people, and why are those people kind of welcoming him? So did Michael pick up the phone and go to talk to the people in Gujarat? Did the Gujarat Chief Minister call up University of Chicago and ask Michael to make that meeting? How did it all happen? And then, of course, I have this fun story to tell. A few months ago, we had a visitor to the JPAL office in Cambridge, and I showed them around the office, and after a while, they were looking highly underwhelmed, not impressed at all. And I said, "You look like you are missing something." He said, "Yeah, I always thought that when I would come to JPAL, there would be like these bank of phone operators sitting, and the phone would be ringing off the hook of people wanting to do RCTs, and they would be picking up the phone and saying, 'Hold on, let me matchmake you to somebody else.'" And I said, "Yes, we do have that, and by the way, we flip a coin to figure out which researcher to call." But it's not like that. So for the next session, we are going to actually talk a lot about how this happened. So I'm going to challenge our panelists to tell us a little bit about how their journey and the partnership started, how did they meet each other, why did they decide to partner with each other, what did they learn through that partnership, what were the challenges, and what went well and what did not go well. And then after that, I'm going to end by actually talking for about 10-15 minutes about something called institutional partnerships, what happens when these partnerships go kind of beyond just individual research projects and kind of transcend that. Charlotte Watts had challenged us earlier to think about that. Okay, so to do this, we have two pairs of panelists. So the first, I'm going to invite each one of them by pairs rather than subject them to sitting here for the next 1.5 hours. So our first group is Pascaline, Dupas, and Carol Nekesa. So if you can please come on the stage. All right, so let me introduce you to both. So Carol has been involved in development work for 17 years. She's currently the co-founder and director of REMIT Kenya, and working to transform the lives of, by supporting organizations and institutions with implementation and service delivery expertise. She previously worked as deputy country director in Kenya for IPA for over 25 years. Yesterday, as Esther reminded us, she's been an enduring presence for a very, very long time. Now, coming to the researchers, I know the researchers a little better. So rather than reading how many affiliated universities they are involved with and what all they have done, I know, Pascaline, you're wondering, there he goes again. Instead, what I thought is I'll tell you a little bit of an introduction, but then I'll try and give you 2 fun facts about each one of them. So is everybody game for that? I know it's evening. Yes? No? Okay, who's the no? Tavneet, you're biased, so you don't get to vote. Okay, so Pascaline is a professor at Stanford. She's also the co-chair of our health sector and has done seminal work, including, when you see these pictures of these mosquitoes trying to attack some bed nets, all of that has Pascaline written all over her. 2 cool facts about Pascaline. The first that I'm personally very happy about, Pascaline is dumping Stanford to go to Princeton. Princeton is my alma mater, so I'm really, really delighted by that. But more importantly, she will be, I went to another colleague, Seema, invited me for a guest lecture, and she said, oh, you can use this particular office. This is going to be Pascaline's new office. But what gets me quite excited is that that office belonged to Angus Deaton. So I think it's quite a transformation that Angus's office is going to be occupied by Pascaline. So really cool fact. The second fact is that Pascaline's partner, husband, Kudza, is as fun as Pascaline is. But also, he's the co-author with Rachel Glenister of this really important book about randomization. So really, RCTs run in the family. We'll just have to test it out on the kids. Okay, so with that, I'm going to hand it over to you. It's completely up to you what you want to do for the next 30 minutes.
All right, thank you so much. Actually, we have a joint presentation with Carol, so we'll take 30 minutes total, the two of us. And let me first say thank you to the organizers for inviting me. It's a great pleasure to be part of this celebration. The truth is that not only is JPAL's 20th anniversary, it's also my 20th anniversary. Not that I'm 20 years old, I wish, but it's the 20th anniversary of my, being a scholar, because I started my PhD, or I officially became a thesis writer in 2003. And it's not a coincidence that it coincides with JPAL's birth, because I chose to become a thesis writer and to try to go become an academic after getting really inspired by my interactions with Michael Kramer, Esther Duflo, with whom I had a chance to work early on. And it was not a small decision, because I really hesitated very much, because before meeting them, I had not been very inspired by academia. Like many of you in this room, since you are here on this celebration of the fight against global poverty, I really wanted to do something to improve the lives of the people living in poverty around the world. But I didn't really see how I would be able to do that through academia. I felt like the image of the academic in the ivory tower was the worst thing one could imagine as an academic. I didn't think that being in the ivory tower helps in any way. I wanted to be out there. And it's when I got a chance to be hired by Michael Kramer and Esther Duflo and go live in Busia, Kenya in 2001, that I started to see the potential to make a difference as an academic. So at the time, it was before Google Map existed, okay? So when they told me, okay, you're gonna go to Busia, I was like, where is that? Oh, it's at the border with Uganda. I couldn't find anything about it. It was at the time, even, you had, not even before Internet Explorer, right? It was like Netscape. You would Netscape Busia, nothing would come up. But fortunately, when I showed up there was Carol. Carol was there. She had already been working with Michael for a few years, and she welcomed me and helped me get situated and learn how to do this work. And so today, I've known Carol for 22 years. My presentation and her presentation won't so much focus on our relationship because we are both kind of like on the research side. So obviously we partner with each other, but most importantly, we partner with many others out there. And so, this movement that Esther has been talking about, that everybody's been talking about, is really a movement about thinking about the pathway from science to impact, being really like a co-creation of trying to work in partnership with the very folks facing the challenges that you're trying to solve, and coming up with solutions together, trying them out, putting them to the test. And it's that vision, or that pathway from science to impact that I think has been very convincing for many of us who grew up kind of in that moment and saw this potential, and that's how the movement got started. So we're going to share with you all of the many actors that are part of this movement, and we'll do that through one example of a research agenda that we've been working on, which is access to clean water. So let me start by stating the problem and give you a sense for what this challenge is. The challenge is that diarrheal disease remains a major cause of death among children in low-income countries. Now, it was much worse before, so the good news is that the number of deaths from diarrheal disease has decreased quite a lot in the last 30 years, but the bad news is that there is still a huge mass of kids who die before the age of 5 from diseases that we can perfectly avoid. And as a segue to the previous session, the bad news also is that climate change is only going to make that worse, because climate change is going to increase the likelihood of extreme weather events that are going to make the water more likely to be of bad quality. So now, on the other hand, we know a lot about the causal pathway from bad water to diarrheal disease. So if you have contaminated water that children are going to drink, they're going to have then they're going to get contaminated themselves, and that's going to lead to morbidity and mortality. Okay, and we know that you can treat water. You can remove the fecal matter in the water through using a very simple chlorine. And then when you treat the water, then it becomes clean. If it's clean, then maybe the kids don't get contaminated and they don't die. Now, we know for a fact from all the work done by epidemiologists and public health specialists that indeed, if you, that there is a causal pathway from having, drinking fecal matter and being sick. We know that you can treat water. But what was not clear is the extent to which it would be enough to treat water to really reduce morbidity and mortality, because there may be some other things that come into play, other environmental factors that may matter for kids' health, and so maybe the water gets clean, but it's not enough to really make a difference. And on top of that, there may be some behavioral factors that also come into play. And so the likelihood that just by treating water you would reduce mortality, that was not very sure. And so for a budget minister who's thinking of how to allocate resources across many potential things, it's not obvious that it's the right thing to do. But the good news is that we now have some evidence, pretty clear evidence, that actually it's enough to make a big dent. So by cleaning water, just that, you can actually get a big reduction in child mortality. There's a recent meta-analysis that was led by Michael Kramer and others that estimates about a quarter reduction in child mortality just from cleaning water, okay? And that's extremely cost effective. That's really something that's super cheap to do. Chlorine, like dilute chlorine, which you put in the water to make it clean, is super cheap, so you can, with $3,000, you essentially save a child's life through water treatment, okay? So who in this room would not donate $3,000 if you knew for sure it was gonna save a child's life? Hopefully very few. So that's highly cost effective to do. So now you'd say, well, it's so obvious that that's something we want to do, and it's so clear. Well, then we should be able to make it happen. Now, the truth is that the pathway to impact, even though we think often that it's going to look like on the left, the truth is that it's more like on the right. And why is that? Because even if you know that something works very well, there is still a lot of issues with execution that come into play. I loved Minister Lawson's intervention right now when she said, well, it's just a matter of goodwill and execution. I completely agree with her when we know exactly how to do things, but very often it's not that simple. You may know that treating water is going to reduce mortality, but then there are still a lot of questions about how do you make that available at scale for many people. And so in particular, in the context of access to water, the first best, obviously, is what we all have access to here. When we turn the tap, the water is clean. We don't have to think, we don't have to do anything. We just have access to clean water without even paying attention. That's like what's called passive inline chlorination. Unfortunately, for many people around the world, it's not an option because they do not have access to pipe water. Okay? So, for the second best for all these other folks who don't have pipe water is to use what we call point-of-use chlorination. So some chlorine bottle that you can have at home, and then after you fetch the water from the stream, from a borehole, wherever you get it, you have to put the chlorine in the water. It's a pretty simple thing to do, but still it requires, it puts the onus on the people. Like every single time you fetch water, you have to put chlorine in it. Okay? In addition to the fact that you also have, to put your bed net up to not get malaria and to do all these other things when you face a high disease burden. And so the research question that were still outstanding, recently when you're trying to think about how to, increase access to point-of-use chlorination, what's the subsidy level? Like how much do you need to subsidize for people to have access to this product, and then how to deliver these subsidies if you want to have that. And so, we've been involved with Carol and others in a series of research studies to try to answer these questions, and that also build on some other work that we had done jointly on, optimal subsidy levels for bed nets that, Iqbal mentioned. And so we can also already have some idea from having done this previous work and building on it that, okay, maybe if you don't subsidize enough, it's going to be really tricky for people to access the product. And so we did a first study in Kenya where we randomized across households whether they would get free chlorine delivered at home. So, you need to treat water every single day. So that means you need one of these little bottles. Like every month, you need a new bottle. So we would give like 6 months worth at a time of bottles to people, compared to I'm going to ignore the free coupons for now, so just switch to the 10 Kenyan shillings and 20 Kenyan shillings. These are different prices that we'll have to pay. And if you compare the 10 and 20 to the free, you can see that when people have to pay some amount, only about 10% of people end up having chlorine in their water when you go to the household and test their water. But when it's free, it's closer to 40%. Okay? So that's the first thing that you see, that if you don't make it free, you lose out on most people. But if it's free, you get close to 40% of households that actually have clean water. Okay? Now, it's not 100%. So in contrast to the work we had done previously with BedNet, where we found that everybody who gets access to a free BedNet is going to use it, for chlorine, it's not the case. There are some folks who don't need it because they have some other way of, maybe they boil their water, or some of them just don't like the taste of chlorinated water. So you don't get to 100%. So if you just give it for free to everybody, drop it on their laps, they're not going to say, no, thank you, because it's kind of rude if someone is nice and give you some chlorine and says it's good for your health. It's a bit tricky to say, no, I don't want it. So people are going to take it to be polite, but then they don't put it to use. So if you want to be really cost effective, you want to target those who actually put it to use. And so we had another intervention, which we call the free coupons, because you give people a coupon booklet, and every month they can go get their free chlorine, but they have to do this action of going getting the free chlorine. So once a month I go to the clinic or I go to a local store, I give them my voucher, my coupon, and I get the free chlorine against that. Only the folks who really care about it are going to do it. So when you do that, you essentially eliminate all the people who are not going to be using it. So you don't subsidize them. Only those who really want, they can all get the coupons, but only those who care about it enough to use it are going to redeem the coupon. So that's that's what we call the voucher program or a coupon program. You make chlorine free to people, but they have to redeem it on a monthly basis to get access to this subsidy. Now we replicated this in Malawi and trying to see whether the results were generalizable across space and time. So we did a study that was very similar, but over a longer time period. And we also tried to ask, well, is there anything that you can do to increase this 40%? Can we convince households that they should really treat water? And so when we did that, we tried to get the community health workers, which are very common in many contexts, to nudge households. And what we found was exactly the same result as in Kenya, which was that essentially you can, through the coupon program, you can increase the share of people who get access to clean water by quite a lot, from it was 5% to 32%, so you get a big increase, but you get quite far from 100%, and it didn't really make a difference to try to get the community health workers to do something about it. They were ineffective at convincing more households to use it. Okay? So I'm going to skip that for the sake of time. So even though you don't get 100% coverage, you still go from 5% to 35%. That's still a huge change, and it's highly cost-effective. There's an NGO called GiveWell that specializes in deciding, what's cost-effective or not, and they are very influential. They have a lot of money, and they've recently decided that vouchers for clean water was highly cost-effective. That copied and pasted this from their website, and they estimate that vouchers distributed via health clinics to women with children under 5 cost $120 annually per person served, and so you can average a death for $2,860, okay? So very much in line also with the cost-effectiveness analysis from the meta-analysis I mentioned before, okay? So now we are doing yet another study, funded by GiveWell, trying to see, okay, actually, how do you embed such a scheme into the existing national healthcare systems? So, for the studies we were doing, we were working with the health facilities, but we were still doing a lot of the stuff. Our team was still involved in a lot of the stuff. At some point, you want the government partners to take complete ownership and to completely embed this into their system. And so to try that out and see the extent to which it can work within their procurement systems and all this other stuff, we are doing yet another study. And to learn from that, we have pilots in Kenya and in Nigeria, and we are also talking with the Ministry of Health in Rwanda to see the extent to which it could work there. And as mentioned earlier by Michael Greenstone, it's always very important to make sure that things are well tailored to the context. So in any country when we go, we're going to think about doing some implementation studies as you scale in order to make sure that it's well tailored to the context. Okay. Now, when I present things like this, it looks like this was just me getting this idea, and then that's how things happen. But it's not true at all. What it really looks like in the pathway to impactful research outputs is really teamwork. And the team is very, very big. So first of all, there are a number of academics on this work. So I was taking all the credit here, but it's actually joined with Michael Kramer that you've heard about earlier and many other academics. But most importantly, in this effort, we have many other members of the research team. So we have typically graduate students and pre-docs and postdocs, and that's how this movement is really happening and getting all of the next generation trained is that we're bringing on board young scholars. So if you are like Hervé Berville's 15 years ago and you want an internship, don't get discouraged by him not getting hired. We do hire people regularly, so please apply. But then most importantly, we also partner with with all these other actors that Carol is going to tell you about.
Good afternoon. I'm so delighted to be part of this team, and just to congratulate Iqbal for the 20 years. I've been in this space for 23 years, so I feel like I have seen some of these RCTs really develop, so I'm so glad. Yeah, the Minister Togeth, unfortunately, she's left, but I just wanted to start by saying that mobile money is the move. In Kenya, we have social borrowing, mostly using M-Pesa, which is the mobile money. So anytime you want to borrow money, we have this joke that check on your phone and see how many people can you just quickly call and they can sort you out. And to us, you can't just call anyone. You don't call the first person on your phone. You have to scroll through and see who have I developed a relationship strong enough for me to borrow. So just drawing about this slide here, I'm going to take you through the relationships that make this to happen. What Pascaline has described really looks like a straight line, but indeed it's not a straight line. That can only be prepared on the laptop. But when you go to the actual field setting, there's a lot that needs to happen. So in general, I know that building relationships in whatever dimension is a blueprint to success, and that is what each project relies on. I know previous speakers have talked already much about building relationships, and I'm going to focus on 4 key aspects on relationships. So first of all, we have the government. Governments have different structures. I'll concentrate on the Kenyan government because that's where I'm very familiar. But for any researcher who is in this podium, I want to let you know that you must always understand the systems of a government where you are working in. Otherwise, you can easily run into problems. And this comes in a number of aspects. So first of all, you need them for approvals. For example, in Kenya, you'd need to get a research permit. You'd need to get an ethical approval. But beyond that, you also need to engage them on set. You need to get their thoughts because they could also shape the design of your study. If they shape the design of your study, the advantage is when you get the results at the point of scaling up, they become your advocates. Or if there's a policy that they're already engaged in and they realize that the results talk otherwise, they would be happy to learn from your study. So it's very, very important to engage the government. Another aspect on engaging the government is also, I'm just relating to the study that Pascaline has mentioned. You need to do a bit of due diligence. You need to understand which part of the government do I need to relate with. Is it the Ministry of Water in this aspect, or is it public health, or both? You know, the government is also a body, so you don't want to get yourself in a situation where you are already creating conflict. So it's very, very important that you understand who you are working with. Another aspect, I know we have some people from the government in the audience. I've heard this sentiment multiple times when you're talking to government people. They'll tell you, is this one of the studies that I'll just read online? You know, something happened in my country, maybe in my county or district, but then they just see it pop up on the internet. So it's very, very important that you set up a process whereby you either sharing with them interim reports or you have a dissemination mechanism such that they are already working with you in that path. I know yesterday we had a lot of information during the talk with building a policy lab in Spain, and today's conversation with Rachel and Santos, they also mentioned a lot on how working with governments onset was very, very important for the success of some of the aspects that they were working on. So I just want to reinstate that one key partner is the government. There are so many ways of working with the government. You know, it could be set up through MOUs, through letters of cooperation, through memorandums of understandings, but also it can be bound on just effective communication. Just passing through and telling them, you know, if you are an international researcher, you stop by and you say, I'm in the country for a few days, you know, this is what we are doing. It's very, very important because then that way, the moment you have your results, you're going to have a ride in the park. Now, I also know that getting the government to collaborate takes some time. I can attest that, you know, it also tests the researcher's patience in terms of, you know, how long do you wait? But I understand that in the government, there are so many aspects they have to look at. So patience is something that I've learned, that for you to be able to get all you need while you work with the government, you have to be very patient. The second party I want to talk about is the community and the participants. You know, research cannot happen without participants. You can have a very nice design, but when there's no one to participate, then you can't have it. For example, in this audience today, you know, we are community celebrating JPAL, right? So in here, we could have a research. So this is what I mean when it's like you must have people for you to work with when you're conducting a research. Now, if I walked in here and I asked, who'd like to be a subject in our research? There'd be very few hands up. How about if I asked, who'd like to be a subject in a randomized control trial? To an audience that has never heard about it. You know, the body language is going to tell it all. So in order for us to be successful, we need to be able to explain the value of the research, the rationale, why we do the randomizations, so that we can get the community on board. Because the worst thing that can ever happen is if you spend dollars of money, you try out the research and nobody is willing. When we talk about take-up, we talk about participants agreeing to participate in a study. And so if you have a very nice project, just like the one we are talking about on the water vouchers, if the take-up is slow, it means that you will not be successful. So it's very, very important that you have to be able to explain to the community. So for example, on this particular study, we are riding on other previous studies. We are working in communities where we have worked before. And that alone is a big, helps us to succeed more, because once the community knows you, they know you've been doing some of these researches, the acceptability is also high. The other thing I want to also mention is, when you are running a study, it's very important that you explain to the audience in the best way possible. It could be the language, it also could be using terminologies that they're used to. So you don't use words like placebo, you know, to a farmer in rural Kenya. You have to look at something that they can contextualize with. That's when they'll be able to understand and also to accept to participate in the study. Yeah, I think yesterday, I know Esther mentioned that she and Pascaline and other researchers are doing this study where they've been following up on people for about 15 years. I also know a study where Dr. Miguel and Michael Kremer did since 1997, following up on people. So this type of tracking cannot happen if you don't have a good relationship with the participants that you are working in. Because following up someone for 15 years, you really have to have had a good way of getting them into the study and even keeping them. I know there are a few who drop off, but it does look like, I don't know what the rate is for maybe the study that is happening with you and Esther, but it's really interesting to hear that there is still a lot of people that you are following up on. Yeah, so I think that is another core aspect. I also want to talk about the third partners. Now, we have people who collect data because most of the people seated here, you look at the data on your computers, it just doesn't magically get there. Somebody has to go and talk to a participant, get the data, and then have the data in the computer. You know, you cannot look at data in isolation. You have to look at multiple responses. So enumerators, some people call them field officers. There are different terminologies that could be used, or research assistants. These are very, very important players in research. I personally started my journey in this research as an enumerator, and I remember just, punching some letters into the computer and not knowing what I was doing because I was just doing data entry. But I have learned over time that it's very, very important to train the enumerators very well. You need to help them understand the goal of the research because they are our mediators. As they talk to the participants, they are able to come back and give us feedback. They can help us shape the design. They can also help us tweak the language because as a researcher, most researchers actually don't even understand the language in which the surveys are administered. So we have to ensure that the researchers, the enumerators are fully on board and they understand the entire study. For example, on the voucher study, we had to train the enumerators very well. They understand the objectives of the study. They know when they should reach out to us to let us know if there are challenges. And we also know when to get their thoughts into the design. So we have found that bringing the enumerators on board is something that is very, very important as a partner in research. Then the fourth and perhaps final one is other key partners. We could say NGOs, it could be other research institutions that are working in the same areas where we are working in. As a researcher, it's very important for you to conduct a due diligence and map out some of the key players in the location where you're conducting your research. You need to understand the synergies that could come up and conflicts, and you need to brainstorm how to interact with them effectively. I'll talk a bit about on the ongoing water study again, because we work with a local organization in Kenya. It's called the Kenya Medical Research Institute. So we already realized that KEMRI was working in this location where we were intending to do the study, and they were collecting similar data to what we wanted to collect. And so what we did is that instead of, redoing the work, we just piggyback into the KEMRI effort and making the best use of our resources. This also minimizes the amount of time that the participants have to talk to the KEMRI enumerators and then talk to the other enumerators. So it's very important that we understand other players, and we also understand any other aspects that we can do to be able to collaborate. But then collaborating with partners is good, but sometimes, there are things that you have to look around. So in this particular aspect, we realize that there may be other players in the same environment. So you have maybe 3 to 5 players asking the same health workers for different information. Could be asking them to record this, another partner is asking them to send them this information. So in the end, the healthcare team becomes overwhelmed, and none of the partners really understands that you are overwhelming them. Therefore, it's very, very important for us to be able to understand who else is working with us and then figure out a solution before starting to engage. Now, I know my time is up, but just as I wrap up, I want to go back to the first point. Partnerships matter, and building them requires an active choice. So why don't you turn to your neighbor and get their contact, such that perhaps when we meet here again, you could be able to tell that, nevertheless, from that conference, I made some partnerships. Thank you.